Why are some CF cases diagnosed so late? Imagine living with symptoms that seem like other common health issues, but the real cause is something more complex. That's often the case with cystic fibrosis, especially when it's diagnosed later in life. Cystic fibrosis is a genetic disorder present from birth, caused by mutations in the CFTR gene. These mutations lead to thick, sticky mucus building up in organs like the lungs and pancreas, causing breathing problems and digestive issues. Usually, babies are screened for CF shortly after birth, and symptoms like poor weight gain, salty skin, or frequent lung infections prompt early testing. But sometimes, the signs are not so clear. One big reason some cases are diagnosed late is because the symptoms are milder or unusual. Not everyone with cystic fibrosis has the severe lung infections or pancreatic problems seen in classic cases. Some people have mutations that cause less severe symptoms, which might include recurrent sinus infections, mild respiratory issues, or infertility. These signs can be mistaken for other conditions, making doctors less likely to suspect cystic fibrosis early on. Genetic differences also play a role. The CFTR gene has many different mutations, and some lead to a milder form of the disease. For example, certain mutations might cause only minor respiratory or digestive symptoms that don't meet the typical criteria for diagnosis in childhood. As a result, these individuals might go years without knowing they have cystic fibrosis. While newborn screening has greatly improved early detection, it doesn't catch every case. Some mutations are not included in standard screening panels, and sweat chloride tests, which measure salt in sweat, can sometimes be borderline or normal in milder cases. This makes diagnosis trickier, especially when symptoms are subtle. Misdiagnosis is another factor. Adults with late-diagnosed cystic fibrosis often have symptoms that resemble other common conditions like asthma, chronic bronchitis, or pancreatitis. Because these symptoms overlap, doctors might treat the symptoms without realizing the underlying cause is cystic fibrosis. Additionally, awareness of cystic fibrosis as a disease that can appear in adults is still growing. Many healthcare providers traditionally associate CF with children, so they might not consider it as a possibility when adults present with respiratory or digestive issues. Diagnosing cystic fibrosis in adults can be complex. It often requires a combination of tests including sweat chloride testing, detailed genetic analysis, lung function tests, imaging, and sputum cultures. This comprehensive approach can take time, especially when symptoms are atypical or mild. The good news is that even if cystic fibrosis is diagnosed later in life, targeted treatments can improve quality of life and slow disease progression. Recognizing that CF can present with a wide range of symptoms and in different age groups is key to reducing delays in diagnosis. Increased awareness among both patients and healthcare providers, along with thorough testing, helps ensure that more people receive the care they need sooner. In summary, some cases of cystic fibrosis are diagnosed late because symptoms are mild or atypical, genetic differences lead to less severe disease, screening methods may miss certain mutations, and there is still limited awareness that CF can appear in adults. Understanding these factors helps us appreciate the importance of considering CF in a broader range of patients and underscores the need for careful, comprehensive evaluation when symptoms don't fit the usual pattern. Always consult healthcare professionals for personalized advice and testing if cystic fibrosis is suspected.